When we are dealing with more than just a drop of blood, we are dealing with what's called blood spatter. It's a group of blood stains that allows you to determine maybe what happened at the crime scene, whether it was a shooting, a stabbing, some type of violent beating. What we do with that blood spatter is try to determine the direction the blood was traveling, the impact that the object may have had on the body, and so we can maybe work back to where the injury actually occurred or where the violent crime took place, find the area of origin. We can tell from the blood spatter how fast the blood drops were moving, and that gives us an idea of the force of the impact. It could also give us a hint as to whether the incident was a homicide or possibly a suicide. When we look at a blood drop, we can have different parts to a blood drop depending on the surface it lands on. If it lands on a rough surface, you're going to get some spikes. Those are these parts here on a blood drop that kind of extend from the central drop. And then you have satellites that can form due to the blood falling from a larger distance and some of the blood actually coming off of the blood drop. Now the spiking pattern, like I said, determines on the surface it contacts. If it hits a porous surface, the blood drop will form more spikes. If it hits a smooth surface like glass, the blood will not have spikes. And it doesn't matter how high you drop it from. The spikes are because of the surface it hits, not because of the impact with whatever it hits. Okay, now blood drops actually, when they fall through the air, are spherical. They are not what you actually think of as like a teardrop shaped. They are actually spherical. So this is an actual blood drop falling through the air. You can see how spherical it is. A blood drop is going to hold its spherical form because of cohesive forces within the blood drop. Cohesive forces means the molecules in the blood are more attracted to each other than they are to the surrounding air. So they ball up. It's the same thing you see. You have a nice wax car and you are washing it. The water beads up. Water molecules are more attracted to each other than they are to that wax surface of the car. So blood drops actually, when they fall through the air, are spherical, not in a teardrop shape. When blood hits at an angle, it comes in and hits the surface and it actually elongates, and we can use that elongation to tell us the direction that the blood was moving and the angle with which it impacted the surface. So when we see a blood drop like this, the tail that you actually think here is actually pointing in the direction that the blood drop was moving when it hit the surface. So when we look at this image right here, I know the blood was moving from the left to the right because it would impact the surface and then trail off and leave these little tails. So the tails actually point in the direction of the blood drop's motion. This blood was moving from left to right. The farther the drop has fallen through the air, the larger the stain. So we can see here in the little animation that if they're dropped from a higher height, the blood drop will make a larger stain on the surface. Now, there is a limit to this. It is affected by the actual volume of the blood drop and whether the blood drop reaches terminal velocity. So eventually you're going to get to a point where the blood drop doesn't accelerate anymore when it's falling through the air, and it's going to hit the surface with the same amount of force. So when that happens, your blood drops are going to be about the same size. After a certain height, the blood drop will reach a terminal velocity, and then no matter whether it's dropped from the 3rd floor or the 5th floor, that drop will hit the ground and have the same diameter because the blood drop has reached terminal velocity, which means it's hitting the surface with the same amount of force. We get to a point where we can't accurately determine the distance the blood traveled. Okay, so it works up to a certain height. Blood spatter can be classified into different types of blood stain patterns, laid out here on this table. If we look at just passive drops, those are simply drops that come from a source and they're dropping straight down, just regular old blood drops. Those are passive drops. Okay, we can have cast-off patterns. So if somebody's wielding a weapon and there's blood on that weapon and they throw their arm back and blood flies back, or they're bringing their weapon down and blood flies forward, it's going to create what's called a cast-off pattern. We can have transfer patterns. So if the suspect's hands are bloody and they wipe their bloody hand on a wall or some other type of object, or you step in blood and you get a footprint in blood or a handprint in blood, those are all going to be transfer patterns. The blood was transferred from one place to another. Sometimes you can use a transfer pattern to help you identify a bloody object. So here would be, we know that's a knife blade on somebody's jeans. They wiped the blood off on their jeans. Okay, this is an outline of a hammer, the head of a hammer. So we can get an idea from the transfer pattern what the bloody object was. Okay, if you wipe a blood stain, that's going to cause a certain type of blood pattern. You can also see on here what's called skeletonization. So when a blood has been sitting for a while, it's going to start drying around the edges first. And actually, forensic scientists can use the amount of dried blood, the amount of skeletonization, to identify how long that blood's been sitting there. So a wipe occurs when an object moves through some wet blood that has already been deposited onto a surface. A swipe is when you actually use something that's bloody and move it across the surface. So there's always a confusion between a wipe and a swipe. A wipe is when there's blood on a surface and something wipes through the blood. A swipe is when there's blood on an object and you use that object and swipe it across a clean surface. And it puts blood on that clean surface. Okay, arterial bleeding patterns. Your arteries, when blood's pumping through them, they're going to pump blood. So if you have an injury in an artery, the blood pumping is going to be evident, and you can see that staining on a carpet or a wall or whatever. It's going to be kind of that heartbeat motion, that up and down motion, kind of gruesome, if you ask me. And then you can have blood trails. So somebody is injured and they're dragging their bloody leg along, or their arm's bleeding and blood's dripping off of their hand as they're walking, or they're carrying an object that has blood dripping off of it. But you can get directionality, which way the person was moving from a blood trail. You can have pools of blood. That's pretty obvious. You got a big accumulation of blood in one spot. You can kind of tell if the victim was moved if there's a blood pool. May appear as somebody's trying to clean it up, so it may be droplets or wipes through that blood pool. You can have a void, so the blood was spattered around something, around an object, and then that object was moved. So a good example here is there's blood spatter. This hammer used to be there, so the blood spattered around the hammer, and it left the outline of the hammer. It left the void of the hammer in that blood spatter pattern. So those are the types of blood stain patterns you can get at a crime scene. With the blood stain pattern, the blood spatter now, you can determine the area of convergence. In other words, you can use the blood spatter pattern to trace back the origin of where the blood or the injury occurred. So you can see as an example here, you just take your blood spatter, determine what angles that blood spatter hit the wall, and then you can trace back from the direction the blood was moving to a place where all of these lines converge, and that's where the injury occurred. Here's a little picture of it. Here's an actual picture from a crime scene where the forensic scientists have determined the angle that the blood hit the wall here behind the bed, and they've used different colors of string to trace back, okay, whatever injury occurred, whatever crime occurred, it occurred somewhere right in here where all of these blood spatter angles are converging. Helps you reconstruct the crime scene. Now, another thing we want to do with a blood spatter pattern, besides use it to find your area of origin, is describe the blood spatter pattern. Okay, from the blood spatter pattern, you can determine maybe how violent the crime was. So one way we can describe the blood spatter pattern is based on velocity. If it's a high velocity impact that causes the blood to spatter, you're going to get really small droplets. Okay, less than 1 millimeter. Okay, these are objects that struck the suspect at 100 feet per second, like a gunshot wound. If you want a medium velocity blood spatter, they're going to be about 1 to 4 millimeters, your droplets are. This is something that's moving about 25 feet per second. This would occur, from a stabbing or a violent beating. If the blood drops are bigger than that, then you probably are looking at an injury that was sustained from some type of blunt object, or maybe they were just hurt and the blood was dripping. A more common way of describing blood spatter is by talking about the force with which the blood hit the wall. If you talk about the force, you're also incorporating that velocity component we just talked about. Because if the blood hit the surface with more velocity, then it was driven off of the body with more force. So velocity is good for describing like the speed and the direction of the blood spatter, but force actually describes that impact. Okay, the more force, the blood drop is going to accelerate and it'll hit the wall with also more force. Nowadays, we describe blood spatter in terms of force more than we do velocity, because velocity is already associated with a description of blood spatter by force. Last thing we need to talk about is, if I'm a crime scene investigator, how do I collect the blood at a crime scene? First of all, I want to make sure I'm protecting myself, wear all the protective equipment, gloves and all that stuff. If it's a pool of blood, I'm going to wipe up that blood with something that's going to absorb that blood. So some type of gauze or cotton swabs. If it's on clothing, I'm going to try to get a cotton swab or a cotton square and try to get the blood off of the clothing. Dried blood, you can still get blood that's dry. You just have to have your cotton swab wet, so you can kind of re-wet that blood and get some of it for a sample. If you are going to store the blood, you want to make sure whatever you wiped it up with is dry first. Dry it at room temperature and then package it. Remember, we package blood in a paper container and store it in a refrigerator or a fridge as soon as we can get it dried. We're only going to put one blood-stained item in each evidence bag, and we're going to make sure we label it appropriately so people know what it is. So that is it for blood stains and blood spatter.